Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. I recently saw an ad for a home medication dispenser. This was really interesting for me. We know that automated dispensing cabinets have been used for years in the acute care setting. It's probably one of the most implemented technologies. And with automated dispensing cabinets, it's kind of like a drug ATM. We have the top 200 or 300 medications that might be given at a certain nursing station, and based on the patient's profile, which orders have been approved for that patient, the nurse can remove medications for a patient and administer them to the patient. Now, in the home setting, this idea has taken off, so we're starting to see automated dispensing cabinets for the home. These are automated pill dispensers, they might be called, or automated medication dispensers. And we all know that adherence is an issue, especially with the elderly that might be on multiple medications. They might need to keep track of when to take those medications, before meals, after meals, with meals, throughout the day. And they might have multiple medications to keep track of, and this is very difficult for them to stay on track. So it's good to have some kind of an aid for them, an electronic pharmacy informatics aid to help them stay adherent with their medications, and even remind them with an audible sound or an alarm when to take those medications, and also when to refill those medications once the prescription has been taken fully and it's time for the next refill. So let me just share my screen. What I did is I went out and after seeing this ad, I quickly searched Google for home medication dispensers, and I found a list of these. And you can see here that there's one that recently came on the market, but there's others that, actually have a little face of a computer and medications loaded in the back, and you can dispense those for the patient and talk to the patient and give reminders, alarms, and suggest refills. I find it really great that we have these tools now that are being used in the arena of digital health or personal health. We've talked about personal health records. We've talked about smartwatches and monitoring your heartbeat and other physical parameters, and number of steps that you take in your exercise, monitoring blood glucose through automated sensor that you can wear, a wearable sensor that's Wi-Fi enabled, so that information can be shared, added to your personal health record, or shared with your primary care provider or your pharmacist in the ambulatory care clinic. And so it's good to see that these medication dispensers now are coming on the market and probably being used more by the patients. I think it'll be a great help in keeping track of medications for our patients, making sure that they remain adherent, get their refills on time, and in general, work towards improved health for our patients. So new technologies that are emerging along the medication use process, especially in the area of digital health, and as we see more and more technologies come out, it's very encouraging that information technology is being applied to the medication use process, and we can help have safer and more effective medication use by our patients. If this information was helpful for you, please like the video and subscribe to my channel, and I'll thank you for that. And in the meantime, stay safe, stay healthy, look after the health of others. I'll continue to work on more episodes, and I hope to see you next time. Take care.